It's a pleasure to be with you all today, and I'm really excited to be moderating today's discussion. Before we go to our panelists, I will hand the floor over to the co-chairs of the evaluation, Gillian Triggs, UNHCR Assistant High Commissioner for Protection, and Susanna Moorehead, Chair of the OECD's Development Assistance Committee. Gillian, over to you to introduce the event. Thanks.
Well, thank you very much, Raul, and of course to our moderator. Yes, I will also go out and buy this book. It sounds fantastic, so thank you. Can I begin then by welcoming everybody who's joining this, and the number of participants, of course, is going up as we speak, but also in particular to welcome all of the coalition that's been established for this independent review. I think it's very exciting that we have such a prestigious group of people. And of course, I'm really delighted that Susanna Moorehead, the DAC chair for OECD, agreed to come in and co-chair this with us. Independent evaluations of the work that we all do is enormously important. And I think that's why this launch of the evaluation is important in itself. As you might see a little from the background, I'm actually not in my office. I'm on holiday in the Tuscan hills, feeling very relaxed. But nonetheless, if my internet goes down, I'll find a way to get back in again. But I think for me, this is a very, very important launch, and I didn't want to miss it at all. So thank you all for joining us. And I'd just like to make a very few comments because Glenn Taylor and others and our panel will give us a much better description of the details of the evaluation and the kind of recommendations that have been made. But perhaps the title tells us really everything, and that is hard lessons and concrete actions. There are some hard lessons that have emerged from this pandemic. And we believe that the evaluation has given us some really good recommendations and some concrete actions, which any good evaluation really should provide. So I'd just like to make a few very preliminary comments. And the first of them is the point of this evaluation is really an important one. And that is that it's to provide an emphasis on the legal rights of displaced people, of refugees in particular, as a consequence of COVID. So it's factually based, evidence-based, but it's founded on the fundamental legal principles that underpin the work, of course, of the United Nations Refugee Agency, but of course of all of you in one way or another coming into this collaboration. So these were the things that we wanted to assess. To the extent to which COVID had enabled protection of vulnerable people, but of course among the most vulnerable are those who've been forcibly displaced. People displaced in their own country or people displaced across national boundaries and people who are stateless without documentation. Those legal rights that we focused on were the right of access to claim asylum, the prohibition on the return to danger or persecution, the right of access to health and vaccinations, of course critically important in the context of COVID, and issues of general protection, child protection in particular, and access to education, and the impact on gender-based violence. Now, some of the findings that are important, the first of them, and the one that really is particularly significant from the point of view of the Agency for Refugees, and that is the denial of access to asylum. It happened very quickly. When COVID, the pandemic became clear, countries shut down their borders. And that, of course, is entirely understandable. This is a global pandemic. It was leading to the deaths of, I think the World Health Organization talks now of over 50 million people dying and many, many millions of others' lives very significantly affected. So we have always made the point at the UN Refugee Agency that certainly frontiers can be closed and health measures adopted. But the concern for us is that many, many countries gave no exceptions whatever for people claiming refugee status. And at one stage at the height of the pandemic, over 100 countries simply rejected any opportunity for a person to make a claim to asylum. The other element was that COVID did enable states to justify restrictions which could not really rationally be justified by health concerns. And our concern right from the beginning has been that that states would bake in those restrictions. They would take advantage of them. Today, we have something like 20 countries that now continue to deny access to asylum. And that's a longer term concern for us because it's absolutely normative, it's fundamental international law and very worrying. But other rights of concern, of course, were the limited access to vaccines. Of course, in a pandemic, it became very clear, as the Secretary General said, that if one person is unsafe, we're all unsafe. It's an interconnected global environment, and it was imperative that refugees, displaced people have access to healthcare and to vaccines. And I think it's fair to say, and this is a mixed report, and Glenn and others will give a clearer, more precise view, but it's a mixed report because we did find, and this is my second point, that many countries included refugees. And that really is enormously encouraging in the spirit of the Global Compact on Refugees, equitable sharing of the responsibility for refugees and displaced people was really accepted as a core principle by most countries. And that's encouraging. But of course, we were concerned by the inequity of the access to vaccines and the logistical and other problems that went with ensuring that the vaccine was available to displaced people. And as you will all be familiar, of course, most displaced people are actually hosted by poor or lower and middle income countries. And that has meant, and brought with it, of course, the light shone on very fragile health systems. And it meant that we saw the inequality that, of course, we don't want to see if we're trying to meet the objective of the Global Compact. And the last point I wanted to make, it concerns local communities. Of course, in the UN Refugee Agency, and many of you listening to this will be well aware of the importance of local communities in delivering services to people in need of protection, need of care, whatever the circumstances. We've all been aware of that. But I think the COVID pandemic really amplified the reality that in some contexts where we couldn't have access, it was really the local communities, the local NGOs, faith-based groups, the local mayors, cities. These are the people who really delivered services on a daily basis. And it is worrying on the figures that I have, that of the funding that goes to national NGOs, that's only about 2% of the available funding. And of that, of the available funding, 0.2% ever goes to local communities. Now, however those figures actually play out, it's a tiny number of resources, or the cash resources and other resources that actually go to local communities. And that if there's a lesson to be learned, and the hard lesson, it is that we have to very significantly scale up our work with local communities to be better prepared for a pandemic of this kind. And to be prepared with proper training programs for the future. Of course, we don't know, but we don't know what the future holds, but we do know that it's highly probable that there will be other pandemics, there will be other natural disasters, there will be wars, as we well know at the moment. So we have to be prepared, and we have to accept the interconnectedness. So I think that's probably more than enough for me, but thank you all very much indeed for being part of it. And I'll now pass, if I may, to Susanna Moorehead directly, if you don't mind, Jessica. And of course, Susanna is the chair of the DAC, of the Development Assistance Committee of the OECD, and we've been really thrilled that she's been part of this coalition. Thank you.
Thank you very much, Gillian. And I think that the first thing I wanted to say was just to thank you personally for asking me to do this with you. I've learned a huge amount, and it's been fun. So what more could you ask for? Plus, evaluations aren't always seen as the kind of most exciting, sexiest bit of what the DAC does, but I think they're one of the most important things, because it is about learning from our mistakes, acknowledging them, but then critically thinking about how we can do better in the future. I don't want to either repeat what you said or steal the thunder of Glyn and others. So I'm just going to say a couple of more general things. the timing of this is, I think, sadly prescient. One of the things about the Ukraine war, it's very hard to see anything positive, but Gillian, you and I have talked about this, that it has shown Europeans that people don't choose to be refugees. I think that there is a very negative narrative when we look at refugees a long way from where we are, and we assume somehow that there is a choice there, and there quite clearly isn't. And I was just thinking what it must have been like to be a refugee during COVID. I think of the fear that many people felt who were safe in their own homes, safe in the knowledge that they had governments who were trying to do the very best, safe in the knowledge that health systems, even though they were under the most phenomenal strain, were staffed by extraordinary people who were going to do everything they can to save lives. And just to imagine what it must have been like to be excluded, to have the borders closed, and to literally not know whether you were going to die of this hidden virus. So it's hard to overestimate the importance of an evaluation like this, that, as you say, sadly, will need to inform what we do when the next pandemic comes along. I didn't want to repeat the findings, but I was also, I think, reassured to know that many of the things that you touch on are core DAC business. So your point about localization and the need to work more with local organizations, civil society, also local government, is a very hot topic in the committee. And I think there are many of our members who realize we must do better on this. And when you look at the resource flows, they are simply not enough. So we need to be prepared to take more risks, to innovate, to build trust in these local organizations. Sadly, the report, unsurprisingly, says amongst this very, very vulnerable group of people, it is always women and girls who are even more so, and the horrific increase in trafficking and particularly the sex trade. That I think is the dark side of humanity during a crisis, but it's very important to document that it is happening and redouble our efforts. The many of the recommendations touch on what the DAC thinks of as the humanitarian development peace nexus. I think peace is often, it's P for peace, but it's also P for politics. And given the scale of displacement and refugees, this is absolutely central to our approach. And it's very hard to ring fence policies about refugees. So we've got to join up better across the piece. And I know that UNHCR is doing a huge amount to try and do that. I think the other thing I just wanted to touch on was Gillian's point that there is a lot of lessons, things that we need to do better, but there's also some good news. And I was particularly pleased to see the finding that donors did adapt their ways of working. We did try to provide more flexible funding to multilateral partners. And I think that for me, that's a conversation we need to bring back to the committee to see whether we can't build on that. And then have conversations with UN agencies about what the quid pro quo is. If we're going to do more flexible multilateral funding, what kind of things will we need in return? And I think the last point I wanted to make is much of this refugee crisis is happening in some of the poorest countries in the world. And it's often countries who themselves are struggling to provide healthcare for their own citizens, who are struggling to vaccinate their own people. And I think we have a huge amount to learn politically, but also socially, about how those communities, host communities, react and respond to people in need. And to make sure that as we focus, certainly those of us in Europe, more and more on the unfolding crisis in Ukraine and doing all we can to help the Ukrainian people, that we don't forget about refugees and displaced people everywhere else in the world who need our support just as much. So that's another big focus of what we're doing. So let me stop there. I read the report with great interest. Huge thanks to everyone who worked on it, and was just a very positive and interesting experience. I mean, there was, a lot of challenge, a lot of expertise, but I got the sense with the team that you were really trying to get as robust an evaluation as possible with inevitably imperfect data. But I think you've done a really remarkable and very, very useful job. And just also to thank everybody who has supported this work and enabled us to come up with a very timely and compelling read. Thank you.
Thanks so much, Gillian and Susanna, for those remarks and that welcome. I'd now like to introduce Glenn Taylor, who is the head of the evaluation team and founding partner and director at Humanitarian Outcomes. He's with us today from Maputo, so I hope we don't lose him. But Glenn, first, congratulations to you and the team on such a comprehensive and insightful report. It was such an interesting read. So we'll start with you, and we have about 20 minutes. But I'd like to just ask you a few questions to give the audience a sense of what you and your team found in the evaluation. And I just want to note for the audience that we will have a Q&A at the end. So if you have questions for Glenn or for the panelists when we move there, just a reminder to please pop those in the chat. So hi, Glenn, and welcome.
Hi.
Hi. So my first question is really about the start of the pandemic. Right at the very early on, it was clear that refugees had specific vulnerabilities and needed special attention. Can you tell us a bit about how that played out and how the response to the pandemic took into account the needs and rights of refugees?
I can. I'll be happy to do so. I think what you'll find with this answer and the others as we go through the Q&A, and it harks back to the input that we had from the chairs and from the management group to begin with, that we tried to find a balance all the way through. I still use the same quote, that this evaluation, I can't remember which of the chairs said it to begin with, that this evaluation shouldn't be a litany of despair. There's positives amongst the challenging findings, and in each answer, I think you'll find that we can begin with a positive statement because there are so many positives that come out of it, but then we inevitably end up with a yes, but there tends to be a little flip side as well. In terms of this question, absolutely, you could tell from the beginning, from the outset of the response, in the way that the global humanitarian response plan, which was the framework put together for the additional needs initially for the COVID response, there was a presumption in the first instance that refugees and other displaced people would be affected based on the nature of their living conditions often, and the intersection of sort of displacement and and COVID was seen, and that was evident in the application of this of the third pillar of the GHRP, the third component of it, looking at those specific needs. So yes, absolutely, at the highest level, in broad terms, it was a priority, and that seems to have been, in terms of the way that that intersection also read across into the work that had been done on the Global Compact, the ongoing work, the Humanitarian Development Peace Nexus, that was mentioned, the SDGs, where this work fit into those ongoing agendas, you could definitely see that as a sort of as a direction of travel that maintained throughout. The flip side, and this isn't a big negative here, but what became evident as we were looking at this is that obviously not all of the response the refugee response could be equally prioritized all the way through, and the priorities that are set early on in the response really do continue throughout the trajectory. So the areas that weren't so well covered in the first instance, inevitably took a long time to recover.
Yeah, thanks. And I think we'll get to those areas in our discussion. But you mentioned priorities, and obviously there was a strong focus and prioritization of public health. Was that also prioritized in refugee contexts, this health focus?
Absolutely. Again, it's a clear-cut answer that the health response was prioritized, and within the health response, the COVID response was prioritized. So I think it's very important, again, to say that this didn't play out evenly. So in terms of the timeline, even though the health response was prioritized, it was inescapable in the first 3 to 6 months of the response when, many movement restrictions were in place. There was a severe lack of access, and the reports that we were getting, from the health sector, you're talking about staff unable to get to work, lack of drugs, lack of supplies, lack of movement for patients. All of these things combined to have fairly severe restrictions on access to healthcare, and obviously, as you'd expect, areas in which there was poor coverage to begin with were then the worst impacted, by those movement restrictions. But health then recovers relatively quickly in comparison to some of the others. And then obviously one has to look across the spectrum of sort of public health responses. There were certain things that were clearly sort of deprioritized, and challenges for ongoing epidemic responses that weren't COVID. And just it's important to remember that COVID wasn't the priority in many of these contexts, as affectation rates rose quite slowly. And routine vaccinations that weren't COVID obviously were affected. Treatment for ongoing non-communicable diseases. And we had some interesting discussions with WHO about the long-term ramifications for this. Another positive, though, is sexual and reproductive health. So what you saw in the health sector was the clear prioritization for the package of minimum standards, and you could see the connection between the global policy discussions and the delivery at the ground level, and that for certain things, especially attended births, where there was a clear focus on that as a priority that still required a sort of face-to-face contact, that it was possible to maintain those services, not without complications, not without severe constraints, but the numbers, the data was pretty clearly showed a sort of consistent level.
Yeah, thanks. That's really interesting. I'm curious about, Gillian had mentioned in her opening remarks about the impacts obviously the closure of the borders being one of the most visible impacts of the pandemic. Can you talk a bit about how this affected refugees and asylum seekers, and what's happening now? To what degree is this still happening? She mentioned that some states have still restrictions in place. Can you tell us a little bit about what's happening and how that's impacting refugees today?
Yeah, and I think obviously Gillian's description was a pretty clear summary of what we found. absolutely, restrictions put in place to stop the spread of COVID legitimately in the first instance weren't consistent with international law, and the right to seek asylum wasn't upheld, in a number of countries. As we went through the evidence, and the evidence on this was quite relatively clear in the sense that a lot of the data we got, UNHCR gave us access to all of the data. Compelling evidence of expulsions, pushbacks, and border closures then stopped the process of resettling refugees to third countries, and then sort of the returns process as well. In the latter phases of the response, there were certain patterns then that started to play out. And Gillian mentioned these as well. Certain governments clearly using COVID as an excuse to sort of reinforce and extend hostile policies. And then what we saw at the end, in terms of a continuation of movement restrictions in certain countries that were still tagged as a sort of public health response, that were clearly a little bit more of a sort of a security measure, and that's essentially the use of again the use of COVID to to continue restrictive practices basically.
Yeah, but there were some successes and there were some good practices by states as well as the international community, and also refugee-led organizations as well. Can you talk us through a few of these good practices, especially when it came to remote service provision?
Yeah, this is a fascinating one, because one has to look at the positive, and there were a lot of positives that came out of this. Restrictions and sort of severe conditions generate innovation, and what you saw was innovative practices, particularly, as you say, sort of remote methods. So online, a lot of services that had required face-to-face, going online. We're talking about telehealth. You're talking about remote access for consultations, remote access for sort of refugee status determination for those interviews. So you can, in very simple terms, things which had required face-to-face, a lot of these were taken online to the extent that's possible. And as such, there's hope that these innovations, will have positive effects going forward, both in terms of efficiency and effectiveness of practice. The flip side, as I said, there's always one. The flip side is that I think in the first instance, it appears from a lot of the interviews that we had, there was an overemphasis on the quality of, or not an overemphasis, but an exaggeration of the quality of services that one could provide through these online practices. And in any instance where these really should require a degree of confidentiality, where you need to be clear that the services are addressing all of the people that need them, then in the end, I think the positives were possibly overplayed in the first wave of the response. I think the other thing which is clear as well, as you look at the who was able to access online services, exactly as you would expect, this requires access to technology, familiarity with technology, the ability to use technology, and that was certainly not universal. And through a lot of the findings, you find a sort of typical pattern of access to those, or lack of access to those who were already vulnerable, and then became more vulnerable as a result. So yeah, clearly positives that came out of this, and at the same time, a recognition that there was a lack of access was driven by this as well.
Yeah, thanks. You've alluded to, throughout your answers, some of the protection concerns that emerged or were throughout the response. And I'm wondering whether, would it be fair to say that this was a protection crisis within a global public health crisis? And, the report highlights, that there were many, increases in violence, both gender-based violence and in some areas communal violence. And, this was also reflected in refugee contexts. Did the international responders adequately identify and respond to these, escalating protection concerns?
I mean, again, I think this is equally clearly not, unfortunately, and this again stemmed through from the first phase of the response, when there was not such an emphasis either in terms of prioritization within the original response frameworks and levels of funding for child protection. We should have mentioned in that question as well, violence against children, so these were not designated in the same way as health as essential services to begin with. We saw the transitioning of, it's an example of safe spaces in camps and other wherever you had the sort of the children's safe spaces and the sort of GBV centers, transition of those into COVID treatment facilities. And it took a long time, I think, for those sort of communities at the global level. You saw it very clearly in the interviews, advocacy for for those to be reinstated as priorities in the overall response. And by the end of 2020, there were senior figures, several very big statements stating that GBV and child protection had become crises within a crisis within the overall crisis. So yes, absolutely. And this is one of the ones I think we can talk about lessons learned in some some of the other responses. There's a tendency to say that lessons haven't been learned, when in fact, if you look at localization, this is a deeply rooted, they're deeply rooted systemic challenges to changing the way that the business is done. So it's hard to portray that as a lesson which hasn't been learned, because it requires more than understanding what the lesson is, but some real shifts. In this instance, in respect of GBV and child protection, these were very clear lessons from the Ebola epidemics. What happens when you have movement restrictions, the tendency for this type of violence in the family and violence against children with education facilities closed. And this is one area where I think we can clearly say that more should have been done.
Yeah, absolutely. There was so much to discuss in the report, and there's so many issues that it touched upon, and you were able to whittle down to kind of 6 recommendations for various stakeholders going forward. And I'm wondering, in our last minutes of discussion, whether you can synthesize a few of those and tell us a bit about what your team recommended going forward.
I can. I won't read through them all in detail. We spent a long time coming up with very specific wording that was, as usual, to the satisfaction of all the stakeholders. It was a really interesting, but still sort of collaborative and collegiate process. The first one really was the higher level issues, and to which Gillian alluded. The need to improve protection and assistance for refugees, upholding refugee law and human rights law and standards in times of crisis and emergencies, and then some pieces underneath that, relatively simple things which might have been done differently. Automatic renewal of documentation under these sorts of circumstances when movement restrictions are in place. Issues around data protection, and there was another one around the training of the sort of local enforcement, law enforcement, and national authorities on issues, you know, sort of non-refoulement and you know, how to operate in under those sorts of conditions. The second one alludes to that last piece around the maintenance of in-person services for protection. So it's more in the planning for future pandemics, and we know that there will be some. So international protection actors and governments really to recognize the importance of in-person services, and you know, essentially to not to default immediately to remote practices to the fullest extent that that's possible, but to maintain the critical face-to-face services for GBV, for child protection, you know, with the full provision of personal equipment, PPE, and those sorts of things. So it's a recognition much earlier on in the developed response that these are going to be issues that are likely to be repeated. With a recommendation in there on the promotion of the Global Compact. Obviously, the Global Compact was in place, and to a certain extent, with the timing, while you could see elements of the GCR, you know, actually working in practice, you know, perhaps the focus was taken off a little bit by the pandemic response. So, you know, what we felt was that the GCR could have been publicized and could have been promoted more during the response, and a couple of recommendations around that. We didn't talk much. I think I skipped over a little bit about the local partnerships. Again, it is incredibly clear, I think, as we walk through this, as we went through the response, that it does not appear that the sort of top-down organization of the response model was possibly reinforced as opposed to shifted, you know, during the response. And when you get the money flowing down and not reaching the bottom, you know, the reporting on the valuable role of local of that money going down. So a lot of what happened was outside of the sort of global data that we were able to gather. So we were reliant on lots of individual examples themselves. You know, again, what is clear is the need to continue to work on this issue of localization and yeah, I've just seen the prompt to wrap up, and I think that was it.
Great, thanks so much. Yeah, I mean, I think your last point about localization is one that is familiar to many, and one that keeps appearing in evaluations. So appreciate that, Glenn. Thank you so much for that explanation of the report, and appreciate your ability to kind of synthesize such a rich report into these questions. And again, congratulations on the report.
Thank you.
Great. I'd love to now turn to our panelists. We have a number of really excellent people on the panel with us. Instead of introducing them all together, I'll just introduce them as we go for the questions. And again, just a reminder to those of you in the audience, so please just continue to put your questions in the chat. Our first panelist is Najiba Wazi Fidost. She's the founder and chief executive officer of the Asia Pacific Network of Refugees. Hi, Najiba.
Hi, Jessica.
Hi. As the president of a refugee-led organization, how do these findings fit with the experiences that you've heard about from refugee communities during the pandemic? Do the findings resonate with their experiences?
Definitely. And thank you for having me today. So I think I can echo some of the points that has already been mentioned by Gillian, Suzanne, and Glenn. The COVID-19 pandemic, it was a global pandemic and it impacted everyone. But one lesson that we've all learned, that it really didn't discriminate based on citizenship. Refugees are part of the communities. That's a key lesson that we've all learned. I think from refugees in remote and isolated camps to refugees living in precarious conditions in urban settings, to all of whose movement was actually blocked by the closing of borders. And again, we heard that from Gillian as well. And the increased state controls, scores of refugees that had been significantly affected both by the pandemic and also by state policies at the time which was implemented in response. So yes, it did challenge everyone, but challenged the protection of the rights of refugees in a way that is quite profound and with possible lasting consequences for refugee communities. Again, having worked with refugees as part of the refugee-led organization named Asia Pacific Network of Refugees, commonly known as APNOR, we continuously heard about how refugees were excluded from healthcare systems in hard-hit countries like Iran or Bangladesh, or how the shutdown of the economy in countries also made the previous self-reliant refugees destitute and desperate, and how also the asylum seekers in countries like Greece remained in cramped conditions for the rapid spread of the virus. And we heard again from Susan already. One other particular issue was the increase of gender-based violence for women and girls, the xenophobia issue, the discrimination, and all of this made it much more difficult for refugees, and again, more in particular for refugee women and girls to access a large range of protections. So the evaluation report, we've heard it again from Glenn, it clearly indicates that the COVID-19 pandemic, it did add a lot of insecurity and vulnerability, to refugees in many parts of the world. At least in my region, in the Asia Pacific, we felt it, we heard it, we saw it. Many refugees faced additional risks and vulnerabilities during this pandemic. And again, this is because many of the RLOs have had fewer resources to deal with the economic impacts of the lockdown. Some refugees in particular in some countries didn't even have the freedom or the privilege to move and practice social distancing, for instance. We had much more less access to medical services due to the legal status, or the scarcity and affordability issues. Some of us had less or even no access to government services and support. We've had very much more less reliable local information about COVID-19, including community languages. So overall, the pandemic really did show, again, I think, the importance of the principle on which the Global Compact on Refugees is based, notably the involvement of people whom we aim to protect, and again, ensuring the meaningful participation of refugees and rightfully acknowledging that they are the first and the last responders to any crisis, including the pandemic.
Yeah, thank you. That really ties in well with my next question around the fact that both Glenn and Gillian mentioned the critical role that refugees played in the response, and they led much of the work that was being done at that local level. From your perspective, how do you see refugee-led groups, their role in ensuring the uptake of some of the recommendations and the learnings of this evaluation?
I mean, if you look at the findings of this evaluation report again, it really demonstrates the extraordinary efforts of all the actors, but again, including refugees themselves in support of the refugee rights in the face of, an unprecedented global challenge. And again, refugees and refugee-led initiatives and organizations were responding to this crisis and supporting each other, and their local communities as first, and frontline responders by providing like medical care, health information, material financial support, education support, leadership and advocacy, and many other things. And if you go to the report itself, again, you will be able to see many great examples of, refugee-led organizations in many different country contexts, of those youth in Uganda, for instance, or the Rohingya community in Cox's Bazar, and many of whom have stepped up, to support in many different and innovative ways. And it was quite unique to see how this crisis was actually turned into an opportunity. So there are many examples of refugee-led initiatives and organizations that were effective, that were innovative, that were very impactful. And I highly encourage everyone to look at the report and to look at those examples. And again, I need to say, we are impactful exactly for the reason that, the needs and solutions were identified from within the communities. We, the refugees, actually know best what really works for us, or what have worked, at least during the pandemic. And again, we're committed and accountable to our own communities. So strong and effective, refugee leadership and refugee-led initiatives, I would say, existed right before the COVID pandemic. I think the only difference is that the COVID pandemic was an opportunity to actually showcase this, while many other international actors were actually forced, to withdraw their services, from spaces where they weren't able to do much. And I think this leadership not only will continue, but it will go beyond not only this crisis, but many other crises. So again, I would like to emphasize on the point that, it was a clear testimony of how we, the refugees, could turn, the pandemic into an opportunity and used our skills to help our communities in which we live. RLOs played a very key role, and again, this is indicated also in the report in terms of efforts in sharing information about COVID-19. And I would like to say that irrespective of the extent to which COVID-19 response has accelerated or deepened localization in refugee responses, it's imperative, that to continue to work on strengthening, a partnership in preparation for future emergencies. And again, aim to further empower and improve, in particular, again, funding and resourcing for refugee-led organizations, considering that they are the first responders. Again, as it was stated in recommendation 4 of the report, it clearly says that we need much more investment in planning response, but I would say much more investment in planning response to future crises, where we are able to scale up, systemic support and leadership to RLOs. And I would like to end by saying that, the Global Compact on Refugees again states that we need to focus on the inclusion of refugee communities and RLOs at all levels of response. And that would mean that we need to be able to create a space for better preparedness of the local communities, including RLOs. And that might mean we need to re-envision, the role of refugee-led grassroots groups when it comes to crisis response.
Thanks so much, Najiba. A lot of really great insights that you shared. And again, what you mentioned around the strength of local organizations, it's not new, but as you mentioned, this sort of catalyzed more recognition and awareness of the strength of local actors. So really appreciate your comments and being with us today. I'd like to now turn to William Shemale, Senior Global Protection Cluster Coordinator. Hi, William.
Hey, Jessica.
Thanks for joining us. So a lot of really interesting discussion already about protection and what happened during the pandemic. In your role as the senior coordinator of the Global Protection Cluster, what do you make of these findings, particularly of the findings that protection was deemed sort of less essential or not life-saving initially in comparison to the health response? What's your reaction to that?
Yeah, thanks a lot, Jessica, and thanks for the remarks from Glenn and Najiba. life-saving in the context where we operate, and we operate in 35 countries where people are affected by conflicts and disasters. So non-refugee settings, but people either forcibly displaced in their country or living stuck in conflicts and disasters, not able to move. And in these contexts, I think it's important to recognize what we all knew and got reaffirmed in practice and by the speakers, that the initial response and the most important life-saving response came from the communities themselves. And how did that saving lives that occurred happen? It happened by communities being there, by prioritizing people who are most marginalized, by spreading hope and countering wrong information. So the life-saving action wasn't only medical, though medical was very important. It was surrounded by this whole continuum of softer actions that saved lives. And in this sense, when we talk about is protection life-saving in a context like the COVID situation, I think it's almost an irrelevant question. What's important is how communities are perceiving the COVID. And COVID and operations in communities and villages and camps where we operate came upon communities in two ways. One, it created some kind of a coping mechanism. People had normal life. They could go to school, they could have jobs, they were struggling, there is bombing, they could hide. And then COVID came and knocked out this shield of resilience, and it became thinner and thinner over time. So when people are stuck like that, then bad stuff start to happen more. We see more girls' marriage, we see kids out of school, we see more recruitment of youth by armed groups and so on. So COVID for us was a coping crisis. People just didn't have enough resilience over time to push back on all the negative effects of it. And the only way to respond to that is also in a holistic way, not only medically. The second impact of COVID was a further marginalization. So those who were already behind, persons with disability, persons belonging to minority groups, persons of a more senior age group, these people were further marginalized. We've seen in homes the effect of that, but also we've seen between communities. So ethnic minorities or religious minorities that were already blamed for many stuff to start with, and there was tension and conflict against them, became in addition blamed for COVID, and tension and conflict increased. So in this sense, I think what we've seen that a soft aspect of protection was very crucial to be added on top of the medical response of COVID to make it make sense, but also a immediate protection response to deal with the ripple effects of COVID had saved lives directly, immediately. And that's an important lesson, to have a diversified, more nuanced response, even when the core is a medical crisis, is so important. So in this sense, a holistic response would need a protection lens, and it does save lives.
Yeah, thanks for that, William. I'm curious, given the lessons that came out of COVID and what you just mentioned, this one about the need for a holistic response and an immediate protection response on top of the health response. Are there actions that the Global Protection Cluster is taking to learn from this? I mean, are you doing anything differently as a result of the findings and what you experienced, what you and your colleagues experienced, and refugees experienced during the pandemic? Are there changes that you're making in this regard?
Yes, I was very jealous of Glenn when he said, and I quote, "It requires more than understanding the lessons, but some real shifts in policies and practice." Brilliant sentence.
Yes. It's one thing to know the lesson, but then to lead to change is another story. Yeah.
Yeah. Three things. First, it made us clearly be able to illustrate the fact that without being there, you can't do physically, you can't do real protection work for the majority of protection problems. And we've always speak about a humanitarian access is limited, etc., and there are studies around it. But if you look at a humanitarian access in a holistic way, the fact that we need to be there to engage with communities, to counter misinformation, to engage with armed groups and change behaviors, this sustained, trustworthy presence on the ground, if we measure that today across all the humanitarian operations, we are in a deep crisis. At best, we reach 25 to 50% of people in need. The other 50% has no chance whatsoever to access a comprehensive humanitarian protection service. We might reach them through a flyer or a phone call or a radio documentation, but a holistic presence, we are in a problem. So first thing we've done is we're turning the heat up on how humanitarian access is perceived. We want it to be perceived beyond the trucks. You cannot truck in protection. We count sometimes humanitarian access to places like Tigray by the numbers of trucks that came in. That's not enough when it comes to holistic protection response. And the way we negotiate humanitarian access with authorities, with armed groups, has to take into account the continuation of programs and services done by local actors, monitoring and this droit de regard from international actors. So we are, a first big change is this shift on how we're perceiving humanitarian access to focus on access that protects. The second element is we've seen the return of the value of community engagement. I mean, this is kind of programming of having people on the ground like Nonviolent Peace Force does, or how Geneva Call undertakes their negotiation with armed groups, etc. These kind of soft, purposed presence on the ground to change behavior, engage with communities, is often very hard to sell. But then when a pandemic like COVID hits, you see the value of this infrastructure. So it's very important to continuously invest in this presence on the ground and engagement with communities and armed groups. And that's an area where we're really focusing on and trying to mount a real scale up of this infrastructural humanitarian service that helps everything else, but is so needed, so badly needed when things go bad. The final thing is moral voice clarity. I think we struggled at the beginning of the pandemic. It's like, are we talking about refugees, about people, about elderly, about persons with disability? Is it Europeans? Is it Africans? Is it Middle Easterns? And it took us weeks, months to have a high level clarity in terms of moral standing of what are we asking for. We're asking for everyone to have access to basic services and basic rights. We're asking for non-active discrimination that is happening. And I feel we need to be faster as an international community to have that, to rise to the occasion beyond particulars and speak about high-level rights in a way that transforms perceptions on the ground.
Great, those are three really important areas. Thank you so much for sharing, William. I want to quickly turn to Manisha now. We're running a bit behind schedule just because there's so much to unpack here, but welcome, Manisha. This is Manisha Thomas, Geneva representative of the Women's Refugee Commission. Hi.
Hi, Jessica.
Thanks so much for being here. We've heard so much about gender-based violence, child protection, about how women, children, people with disabilities, you know, in these refugee contexts were impacted by COVID. All the presentations have touched on it at some point. I'm sure this isn't surprising to you or your colleagues. So if you could just talk a bit about how you see women rights groups or activists or broader civil society should use these findings to better advocate on behalf of these groups, and maybe you already are doing so. So if you could share a little bit about how this has how the pandemic and what's come out of it has impacted your work, that would be great.
Thanks so much, Jessica. And firstly, a huge thanks to Glenn and the team that put the report together, as well as the management group and the reference group as well. I think there's, as others have mentioned, there's a huge wealth of information in the report. So do strongly recommend that people do read it. I think, as everybody has mentioned, there was an increase in GBV, lots of concerns around child protection. Persons who were already marginalized were even further marginalized during COVID. I think I'm actually going to turn the question around a little bit. I think the advocacy around really meeting those needs has been ongoing for a really long time. And it comes back a little bit to what Glenn said, there's lots of lessons identified that, GBV responses are life-saving, that child protection is life-saving. We don't necessarily learn those lessons. We're good at identifying lessons, I think, generally in our community. We don't always apply those, unfortunately. So I think there's tons of advocacy that's been going on. The call to action on protection from GBV in emergencies applies not only in refugee settings, but also IDP settings. And that brings together states, UN agencies, international organizations, and NGOs, and a lot of local organizations. And in the roadmap right now, under the call to action, there's a real emphasis on the role that local organizations play. So I think the advocacy is there. I think what we've really seen, and is highlighted in the report as well, is that oftentimes the recognition of the work those local organizations do and women-led organizations do doesn't actually then translate into the action that we need in terms of funding, in terms of support. So Susanna, it was great to hear you say at the beginning that we need to be working with our members in the OECD DAC to be able to take more risk, because I think what we've seen, particularly in the last several years, despite the commitments made under the grand bargain to fund local organizations more, is we haven't seen that sharing of risk from donors and organizations. And I know there's a lot of efforts within the call to action, looking at sort of the financing elements, what could change. But I think really fundamentally, the buck kind of needs to go back to the donors and say, how much are donors, and that includes not only government donors, but international organizations and international NGOs, how much are you going to be willing to, share the risk so that you're being a little bit less risk averse, have some more risk appetite so that we're able to get money to frontline responders. Because as Najeeba mentioned, lots of refugee-led organizations did a great amount of work around GBV prevention, risk mitigation, and response. And I think it's time for the advocacy to be taken into that next phase of action, I think.
And is it just funding? I mean, is it really just sort of undoing this lack of risk appetite from donors in the big organizations? And would funding sort of answer it, or are there other sort of blockages or obstacles that we also need to kind of take into account? Because as you mentioned, and Glenn and I sort of touched on, these aren't new recommendations, or not that they're not new recommendations, they're not new findings. We see them in so many contexts, and what are some of the either examples where you've seen this work best, or some other things that need to kind of shift aside from the risk tolerance?
I think that's a great question, Jessica. And I think indeed, it's not just the money. I mean, money is one element of making things happen, but I think it's also within organizations, how much are we really prioritizing elements like focusing on GBV risk mitigation, prevention, and response? How much are we focusing on child protection? And I think a lot of times within the humanitarian sector in particular, there's a lot of priorities that leaders are faced with. And yet GBV and gender equality even are often at sort of the lower end of that prioritization list. And that can be because of pressures internally, in terms of getting more funding for the organization, more, more kind of attention paid to the organization. But I think fundamentally, so many women and children in particular, being the vast majority that are affected by GBV, it's not seen as a priority by a lot of the leaders in organizations. And I think that fundamentally needs to change. I think we also need to see a change in access to those different coordination bodies. So even when the Global Humanitarian Response Plan was put together, how much access did local organizations or women-led organizations have to those processes? We're not doing a lot of our meetings in languages that are local languages, or we don't have interpretation or documentation in our systems as a global humanitarian community, have become extremely heavy and complicated, which makes the ability of organizations that don't have necessarily huge numbers of staff to deal with all these heavy processes, makes it really hard for them to be able to access those. So where it has worked well is where, there's organizations or, coordination bodies that take the time and effort to ensure there's interpretation, to really work with local organizations to make sure that their views are really reflected in any plans, that we're also really being accountable to populations that are affected, right? So really involving them in the design of programs, in the delivery of programs, and then in the monitoring and evaluation. So I think it's a broad range of things that needs to come together, but I think, as you said, it's not new issues. It's really how do we make sure that the lessons from how it worked for refugee rights in COVID really get applied so that we're taking the views of individuals that are affected more seriously and making sure that they're really at the center of our operations and not those of us sitting at the global level that are the ones dictating everything.
Yeah, thank you. I'll turn now to Klaus Lindroos, Deputy Director General of the Department for Africa and the Middle East, Ministry of Foreign Affairs for Finland, to kind of hear your thoughts on all of these issues that have been raised. Welcome, Klaus.
Thank you, Jessica.
Sorry.
Yeah, nice to be with you.
Thank you. Nice to have you. Finland was part of the management group for this study, and you were a strong and early supporter of refugee rights during the pandemic. Tell us a little bit about why this is such an important area of work for the Ministry of Foreign Affairs and how other bilateral donors should use these findings. And maybe you want to pick up on a little bit of what Manisha said in her statement around the risk appetite for donors.
Yeah, thank you. And also just to say that Finland is very happy to be associated with this report, and also on our part, a big thanks to all of you who have taken a strongly part in making it happen. And I would say that from a Finnish point of view, the starting really point is that we are currently witnessing a time where the rules-based international order is quite seriously challenged. And for us, like most of the other countries in the world, being a rather small nation, we see this as a very big problem. And we also see the effects that it will have, including on refugee rights. And for Finland as a donor, a lot of our development and humanitarian policy is really based on a strong belief in upholding the rules and regulations and systems and mechanisms that we have created at international level. So in this also context, I think this is a very timely and important report. And I think it will also help us both as a donor and as a country, as a government, to highlight the need to ensure that refugees' rights will be respected also when situations are rapidly changing, when we are facing new situations, and that whatever restrictions are introduced, that they must be also based and in compliance with international legal obligations. And finally, I think also this report will help us in preparing for future situations, be it pandemics, be it other sort of global level crisis. And I think the challenges we saw in providing vaccines, other essential equipment, that it is very important to see what we can learn, how we can do better next time. And also for governments, I think it's important to kind of resist the temptation of doing small-scale bilateral initiatives rather than relying on the international coordination mechanisms that we already have in place. Thank you.
Thanks, Klaus. I'm going to turn to our next panelist now, because my next question, there was also a question from the audience that's similar. So I'll wrap it into that question when we go to Q&A from the audience. But last but certainly not least, we have Karine Jabra, Director of the Division of Programs for the Interparliamentary Union. Hello, Karine. Thank you so much for being here.
Hi, Jessica.
And you're our last panelist. And so I'd love if you could just talk a little bit about the role that states have and their international responsibilities and obligations to uphold the protection of refugee rights, including during times of crisis. What actions do you think are needed to better support states given the experiences during COVID and what the report has revealed?
Well, first of all, thanks for having me and including me in this process, including the Interparliamentary Union. And just to maybe follow up on all of the references to inclusion and coherent and holistic approach, I think it says a lot that all of those stakeholders have taken part in this coalition effort. So I think this is quite a signal and a strong message that we should follow up on in terms of what we do next. As you said, states have a crucial role in terms of defending and protecting the rights of refugees, especially in times of crisis, whether in terms of upholding their rights through legislation, ensuring that budgets and allocations and services are enabled and that no one is discriminated against. And we've seen that the COVID-19 pandemic has yet again confirmed that those that are most impacted by any crisis are the most vulnerable, with heightened insecurity, heightened inequality, and reduced access to care and protection. So states have to build up their response and there's a lot to do. But my answer will come maybe from one part of the state, if I can say so, because I will come from the angle of parliaments with whom we work as the Interparliamentary Union. And they are state actors like many others, the executive, the judiciary, and local governments and state machineries, etc. And so maybe my first recommendation in terms of what we need to support or to enhance support for states to take action is to clearly identify the different roles of the different state actors, because they're not the same, and each will require different approaches, supports, and needs. And I think this is very important. And so for parliaments as one state actor, I think their role is very clear. I mean, they have three, I would say, major obligations and responsibilities to uphold during crisis and post-crisis, if I can say so. One, it's legislation and passing and reviewing legislation to make sure that the basic rights of refugees and those that are forcibly displaced are upheld or are not reformed in such a way that they are now discriminated against. So this constant watchdog role and legislative role of parliaments is key. And more importantly, in developing legislation, I think parliaments have another additional role, which is to make sure that the process is inclusive of refugees. And this is something also as well that we've seen states carry out, and parliaments as well, which I think needs to be built on. The second role is oversight and control of the government, and also keeping, budgets aligned with needs. And here again, we've heard so many lessons that came out of the report saying we needed more investment in grassroots, we needed more investment in GBV, we needed more investment in child protection. And there again, I think these are some of the responsibilities of parliaments to follow up on those needs through measures and budgetary allocations. And the third one is more about the cultural and societal change that parliaments can lead. And we spoke a lot about stigmatization of refugees and challenges and understanding and making sure that there is this societal acceptance that you cannot deal with one part without dealing with the other. Everyone needs to be included in an equal basis, or else everyone's going to suffer. So I think this role of MPs in changing mindsets and building a coherent approach is key. So what can we do to help states or parliaments? I think one this report is, first of all, an extraordinary tool today to stock take, and we need to give it more visibility, disseminate it, and open spaces for discussions with the stakeholders in terms of, okay, what have we learned from that specifically and what we can do as such. At the IPU, we will hold a debate at our next assembly on this. We will get parliaments to look at some of the recommendations and see what they can share and you know, in terms of best practice and next steps. So I think raising awareness globally, but also making sure that those debates and spaces for discussion happen at the national level as well is important. So not just global, but national, and for us within parliaments and within parliamentary committees that actually deal with refugee protection issues. This is where the debate needs to happen. So that's the first thing. The second one, I think we need to be able to continue to offer expertise and support to states so that they can call on all of us so as to, you know, take action in an effective way. So I think this needs to be clear and strong, and we need to, as I said, have tailored support develop. The third point I'd like to raise is we need to keep the momentum, the political momentum. We have here interest, we have needs, and we need to use global processes like the GRF, but also big assemblies like the IPU to maintain the pressure and the momentum, and to have a monitoring exercise in terms of what's going well, or what has changed, and what needs to be tackled as a priority. And my fourth and last is we need to invest in partnerships. This was said before, but partnerships within states, the different branches, and also civil society, media, etc., but also between states at a regional, at a global level, because as everyone has said, we're all in this together, and we need to find solutions together. Thank you very much.
Well, thank you so much, Corinne. That was so much packed into a few minutes. So I appreciate you having such a rich response in a few minutes. We have about 9 minutes left. We do have a couple of questions from the audience. And thank you, Glenn, for answering some of those already in the chat. But there was another one that was to you, and this is from Arvind Munger from FCDO of the UK. He had to leave, but he asks what your assessment is of the COVAX humanitarian buffer, which was designed to support vaccine access to populations not covered in national vaccine plans. What do you think are the key lessons to ensure vaccine access in humanitarian settings as we think further about pandemic preparedness? And Glenn, if you could keep that to 1 to 2 minutes, that would be great. Thank you.
That will be quite easy. We simply recognize that COVAX was a very, very complex subtopic in its own right, and we didn't really take a detailed look at that. As was alluded to in the comments, what we saw was we saw a very, very quick pickup of acceptance that refugees ought to be part of vaccines. The inclusion aspect was taken up quite quickly, and the data was quite solid. Equally, the data on how many refugees were actually receiving vaccines was decent as well, and that was, you know, still bumping along the bottom for a considerable period of time. More to do with access, more to do with you know, all of the issues that were widely reported on vaccine access more generally. So apologies, I can't give a detailed response on that one.
That's okay. Thank you for that. I'd love to come back now to Klaus. We had a question that we were going to ask in the panel around commitments to gender equality, and we heard a lot about that from Manisha as well. It's just striking to see how little funding went to women-led organizations and civil society groups, and GBV was also underfunded. So someone also from the audience, this was Susanna from ALNAP, asked about local communities being first responders as well, and funding also not reaching them directly. So despite talk of localization, also commitments to gender equality, you know, we don't see those showing up in the funding pattern. So what do you think that donors can do to better incentivize partners and ensure funding reaches women-led organizations, refugee-led organizations, and that some of these commitments are seen? Again, in 1 to 2 minutes, please. Thanks.
Thank you. I hope you hear me now. Yes. Yeah. Important question, and one that's been with us for some time, and clearly this shows that there is still a lot of work to be done. And I also remember from attending many of the donor group meetings, both with the UN and with the Red Cross movement, that there is this problem of sort of making the political commitments and the political objectives also operational, and this discrepancy sometimes that what we discuss at like central level, and then you go at country and local level, and you see that very little of it actually is taking place, and it shows that this is work that needs to be continued, that needs to be done at all levels as donors, and from at political level you can always make the point. You can try also in your funding decisions to ensure that these aspects are being somehow looked at. But I also know that inevitably in some places and on some occasions it simply takes time also to get the mechanisms and the systems up and running. And I think also this report shows that there is still a lot to be done here. And I think from a donor perspective also, the challenges in making sort of the response more local and reaching out better directly to local organization, and there I speak from my own experience that really a key, I would say, challenge is related to also the donor ability to monitor, to remain in touch, to get the information, to ensure that we have a full picture of how funding is being used, because that is potentially very detrimental to our own work if we are perceived as not having that ability. And that's why a country like Finland, we work mainly through the UN system, through the Red Cross movement, and sort of we also hope that UNHCR and other organizations will be able to better tap into the work of local organizations, and sort of so that we can continue our work supporting the UN system, and then making sure that the system itself is getting better in using local channels, because we do recognize and we do know that they are mostly, I mean, they are the first responders and those who knows best what is needed at the local level.
Yeah.
Thank you.
Thank you. I think that's a great way to end. So many different perspectives from governments, protection actors, local organizations, and the research findings as well. So this was a real pleasure, and I feel like we could continue the conversation for a few more hours, but we have to wrap up now, and I'd like to turn back to the evaluation co-chairs, Susanna Moorehead and Gillian Triggs. If you could briefly close with some of your reflections. We have about 2 minutes left. Thank you.
Well, look, let me go first. I don't think I can add much more to a very rich discussion, other than, from the point of view of the DAC, to commit to really using this evaluation. I mean, an evaluation is only as good as the use to which it is put. So, thank you once again, and please rest assured that we will do everything we can to try and implement the really practical recommendations, and I think very, very forward-looking as well. I mean, that's the critical thing. The whole point of this is to be better prepared next time. So thank you all very much.
Thank you, Susanna. And for my part, yes, again, a really excellent discussion. And really reminds us at the UN Refugee Agency how we need the benefit of a wide range of experience in how to respond. Just a couple of very quick points. One, the very strong emphasis on getting to local communities, local groups. We know this to be true, but I think we have to take the point that's been made, and that is we must move from identifying the problems to operationalizing. And I think that that's something that we will look at. We will reflect on all of this internally within the UN Refugee Agency, but the need for speedy operationalization and to maintain the momentum of this report will be very important. So thank you to Glyn and all of his team for producing a really scholarly, solid piece of work that I think will help take us into the future. Just a final point, and that is one that I think it's been made by a couple of speakers, and that is really the enormous importance of in-person support. That's partly linked, of course, to communities and local group, but it's one thing, and I think Glyn's made this point, it's one thing to recognize the importance of digitalization, of innovative technologies and so on, but they still leave an awful lot of people behind. And I don't think anything can really replace the importance of people on the ground, people working with local communities and really delivering to those people who are the most vulnerable in whatever the crisis is. So I think with that, if I may, before I run out completely, thank you all so much, and back to you, Jessica. Thank you.
Hope you're okay, Gillian. Thank you all so much. We are wrapping up on time. And again, really encourage everyone to read the report for further information. Thank you all, and have a great rest of your morning, afternoon, or evening, wherever you are. Bye.
Thank you. Bye.